Now we can talk about the knee. So the knee, basically, usually when people have knee pain, it's caused by the same mechanics. It's when the IT band gets tight and it laterally rotates the tibia. That offsets the knee, so when your weight comes down into the knee from the body into the femur, if the tibia is laterally rotated, there's nothing under the knee to support the weight of the body. So the tendons freak out and get tight, and the ligaments get stressed and can actually shear and tear. So you want to release the IT band. This allows the tibia to come back under the femur so that the knee can be aligned properly. And the stroke I'm doing is the way to lengthen it out. It's kind of imagine like dough, making the dough lengthen out longer and longer. When the IT band gets long enough, then the tibia gets to be able to roll around, so it comes back under the femur. Imagine that the lower leg rolls like a rolling pin, and with kind of the way it's laying there. And when it rolls under or back, it's because the IT band is tight or loose. Imagine the IT band comes around to the front of the tibia. When the IT band is tight, it rolls the lower leg to the outside, which points the foot to the outside like a duck. And when you release it, the foot should start to point back to the inside. That means that the tibia is rolling back under the knee where it's supposed to be, and knee pain will be corrected. This actually takes undue tension off of the ACL, or the anterior cruciate ligament is the main ligament inside the knee that can tear, especially from athletic injuries. And the reason it usually tears is because the IT band is tight. So you want to do this to take tension off of the ACL. This prevents tearing of the ACL. I honestly think that in most ACL tears, if the IT band were released first, the ACL tear never would have occurred. So see how I got the stretch going with the one hand? I'm balancing the leg, and with the other hand I'm going in and I'm doing yang-yin pulses to get releases in the IT band wherever I feel the tightest fibers. It's a wide band, so it's not necessarily that the whole thing is tight. It's usually certain fibers are tighter than other fibers. So that's what I'm doing, is I'm finding those tight lines of tension, running through the IT band and doing yang-yin pulses to release it. And I can actually see the tension in the outside of the thigh starting to drop. You see the tibia it's rolling back around. Oh, look at the foot. See her foot starting to point down towards the table more easily now. Let me try a little bit more. Usually I try the releases out in the middle of the IT band like I just showed you, and then I migrate my technique down towards the knee. So with the fingertips of both hands, I'm really zeroing in on the IT band and stretching it towards the tibia. Imagine that I'm trying to roll the tibia so that the foot points even more under towards the table with that stretch point release. Yang-yin pulses, and that's how you do it. So that's how you fix a knee, and it usually works. Give it a try, and I'll catch you on the next video. Make sure you do the drawing so you know where the muscle and the muscles that come into the IT band are and where the IT band actually is.